the different types of children's nurse that you could be?
Oh, that's such a broad question, but is what's quite exciting about sort of being a children's nurse. So a lot of people work in sort of the acute setting, so within a hospital, but even within that, there's so many subspecialties. Every part of the body you can specialize in. You might be like a renal children's nurse that is kidneys, or work within oncology, so kind of cancer services, or work within theatres. And even within theatres you can subspecialize within sort of scrub or anesthetics or recovery. And then within the hospital settings there's sort of tertiary regional hospitals that are really quite specialist, or sort of district general hospitals which may have a sort of children's ward with more sort of general levels of care. But also within children's nursing you can work within schools, you can work in the community. So there's so many different options of sort of specialising, and you can move around sort of within them. So just because you specialise for the as part of your career, that you can move to sort of specialise in something else later.
Would you say that it's a challenging career? Is studying hard to be a children's nurse?
I think it is challenging, but really rewarding. You have to work really hard, whilst at university, and balance all the academic requirements and the placement hours that you have to do. And it's a career where you'll sort of learn for the rest of your career. You learn something new absolutely every day. So if you want to be challenged and you want to continue learning, then it's a great choice of a career.
And what would you say are kind of skills or personality traits that you would need in order to be a children's nurse?
Oh, good question. So it's got to want to learn, be a really good communicator, because you'll be needing to talk with a really wide range of sort of multidisciplinary team within your your colleagues, but also with patients and their families. So within children's nursing you will have parents or carers with the children the majority of the time, so you need to adapt your communication skills to talk between all those groups all the time, problem solve, think differently to solve problems, be organized, have good time management, lots of different skills.
What are the different types of children's nurse and paediatric nurse?
There's no limit, to be honest. I've certainly found that throughout my career I've done so many different things. It depends on how willing you are to apply yourself, how willing you are to learn, whether you're willing to develop in a career and then take a step sort of sideways or backwards to go forwards in another area. So for example, I've worked in children's respiratory tertiary referral, which means the very specialised cases. I've worked as a child health nurse in Germany. I've worked in Australia as an agency nurse. I've worked in general paediatrics. I've worked in paediatric cardiothoracic intensive care. I've worked in neonatal intensive care. I've worked in an adult A&E as a paediatric nurse. I've worked on the paediatric ward as a matron, and now I'm working in the GP surgery.